that's not my area, I would say. So social services, I think it's important. Community centers are very important, especially, I guess, new moms, for example. I mean, even if they ask me, I'm probably going to read something and just give it. But when they have something like another mother who experiences the same problems and they go through it, I think that will be really important. That's why I'm saying it's a human communication, and just not a piece of paper or just a talkie or something like that. You cannot replace that. So that's that's my thoughts.
I think things like workshops where people actually get educated on these issues, like other providers in the system, other healthcare professionals, it's very beneficial. I mean, I think that a lot of times as healthcare professionals we come in with biases and we don't acknowledge them. That's the truth, right? Everyone wants to believe that they're correct in what they believe about other people, but learning how to acknowledge your biases and how to openly communicate with your patients, I think, is something that I found invaluable in residency. We started doing a lot more of those, especially centered around IV drug users, around addiction. And I know that a lot of residents have benefited because a lot of times these patients come in and we just want to believe that they come from a certain background and we can't acknowledge that because we don't know how to relate. And I think sometimes going to workshops where there are people who have experienced the issues or people who might know more about these issues can talk to us and teach us a little bit more about how to acknowledge that bias and how to overcome that. I think that's something I found really helpful.
So if you were able to, what would you change about your workplace or healthcare system that would make it better for you and others like you to interact with diverse populations?
My number one would be having access to more in-person interpretation. I know that using the phone is really helpful, and we strive to use it for everything from check-in to the provider seeing the patient to the social workers meeting with patients to schedule appointments. Our patients speak 60 different languages, which for a not very large health center is a lot. So my personal dream is to coordinate hiring more in-person interpreters, especially for our topmost spoken languages.
Well, if I can say, well, sometimes you just start by yourself, actually, with changes. So one of the things that I might think would be for myself would be possible to learn something like a new language. It's not going to hurt. I mean, it will be actually more approachable for the patient, and of course, it's going to be an open for me as well for having access to the other person. Second, to me, it's more like communication, information, especially with people who are just newcomers. For the people from different socioeconomic status, they might fear that, for example, certain interventions, certain things comes with an expense, or they don't have free access to healthcare, especially with children, which is not true. So those are things that possibly I think that you can emphasize when you provide information, so they have that experience and they can truly actually fulfill the whole state support without them feeling like they are helpless or somebody's not helping them. So I think that information is very helpful as well.
I think having access to resources, just like knowing all the resources that are available, would definitely help with engaging with different populations. It sounds like there are so many different community centers and so many different populations of people working in Pittsburgh to help people, and I honestly don't know half of them. And I feel like just knowing what kind of community centers are available, how can patients get there? I've got a lot of patients in the clinic who are Spanish speaking and would like to go to the center, and there's no way for them to get there because no one knows what kind of transportation will get them there, how do they access the bus system, and I'm sure there are ways that this has all been figured out, but sometimes just having a centrally located resource I think would be really beneficial.
Yeah, I would agree with that there are very many communities within this region that are very well organized that we know nothing about or how to access. So the next thing I'm wondering is, what would you say you've learned from interacting with people from diverse backgrounds?
And so even when I'm connecting to resources before I jump in with what I think the solution is really listening to each patient's individual experience of that need to figure out if that resource would even be appropriate for them.
I think what I've learned is that regardless, I'll say the nationality, the race, or the color, everybody actually respect each other. They feel human experience, that they wanted actually to feel like humans, to feel to be appreciated. I think that empowering them and giving the knowledge and making sure that they understand that as a provider we are trying our best regardless. I think that that's one of the things that I've learned regardless, because in the end a mother is a mother for a child, or the parent is a parent, or a sibling, things like that. So those are the most important things that we should not forget, that we are humans in the end, and try to give our best for patients' care.
I think I agree with both of those. I think that one thing that all this taught me is how to be a much better listener. Just because I have certain beliefs or I have certain desires for someone's medical care, that doesn't mean that that's the correct way, because I think there are a lot of ways to do the correct thing. I think that sometimes just understanding where someone else is coming from, especially from a cultural perspective, is very important. For example, like end-of-life planning, I think is very different in every culture, and I don't think that I understood that until I had to interact with patients of different cultural backgrounds and just understanding what their sense of end-of-life care was. And I think that acknowledging that every person is a person. I think that sometimes we get so engrossed in, oh, we're all from different cultures and we have different expectations of care, but at the end of the day, everyone wants to take care of their mom, right? And everyone wants to take care of their kid. And I think that remembering that has helped me a lot, just understanding other patients and what they might need in their medical care.
So I think unfortunately the thing that I've learned has been a pretty negative one, and that is that we still have a lot of work to do with a lot of our colleagues, which makes me sad, but it gives me opportunity to know that there's still things that we can make better. So we heard from some community members earlier. I'm wondering what your thoughts were about their experiences and how you might have helped to have things done differently from what you heard.
I'm a big advocate for language access, and so hearing about times when it's not being used properly reinvigorates me. I'm on a lot of lists and a lot of offices. But I think that sometimes it feels simplistic to think that language is the only thing missing, but it really is the first step. So when practitioners aren't even willing or able to offer that, and no communication is happening, and the patient isn't having any power or say in their own care, that's really disheartening. So I think I learned that it's not as simplistic as I sometimes worry that it feels, but that it really is the first step that we have to really educate our colleagues and partners on, so that everyone has equal access to their care.
What I've done differently probably would be just trying to connect people with the same, within the same community basically, and trying to make sure actually they, for any question, they can actually get somebody who they can go and question. I think today actually we had a patient with a rare disorder, PK, which is fatal category reaction, and one of my attendees was saying that they did a study actually years ago, and they were saying that regardless of the information that the medical provider was giving, or the nurse or the attendings, doctors, the best actually learning experience when a mother was teaching to a mother actually. So that's very powerful, I'd say. Regardless, we try to, there is still a distance between, a gap between a provider and patient. There are different cultures. Some they see you like somebody who decides what's the best for them. Some other cultures have a different perspective what the doctor should be. But if you give access to somebody who experiences the same thing, I think that would be one of the best ways actually to empower them and give them more accessible, and they can share their experiences. Now there are a lot of more like Facebook pages, community, so there's a lot of things that can be done. So I think those are, to empower the community within itself would be one of the best things. And also to provide those resources, I think is very important.
Yeah, I think it's mostly about information. I mean, I think both speakers kind of talked about situations where there wasn't enough information, or the information wasn't relayed appropriately. Even with the burn patient, I can imagine how frustrating that is when you come into an ER, your kid is burned, and everyone just keeps asking you about screening. The things we have to do is asking you about abuse, right? And I'm not sure if there ever was a conversation that would culturally make sense, right? Like, hey, I just want you to know that I know this sounds crazy, and I know this sounds like I have to do this, but we will take care of your daughter, I promise, but this is something that we also have to do. Because if that's not the way you've seen medicine practice before in another country, or you just haven't seen medicine practice like that before, I can imagine that's really frustrating. And I think that that's something I think I would have liked. I don't know if I would have done it, and I think that something I would want for the future is making sure that when it seems like a patient's family member is not getting taken care of, no matter what the cultural circumstance, and explaining why I'm asking all these questions before injecting them with a lot of medications or sending them to a different floor. But that's really what I took away from that.
And the thing that I found interesting and frustrating was the conversation about mental health services and recognition of the impact and presence of mental health, which is pretty, I think, pervasive throughout many different cultures and communities in this world, actually. So I'm just wondering from our panel, before we open it up to questions, if there's anything about your experiences with diverse patients, families, and colleagues that we haven't talked about that you wanted to share.
The last thing I would add is just going back to the power of listening. As we see new communities come to Pittsburgh, I think it's really important that we're connected into those communities and learning from their leaders and sharing both directions, not just what we can offer, but also what the community has to offer and how to listen to their stories.
What I can do, one of my closing remarks would be basically trying to empower the communities, trying to make sure that there is communication between the community and the healthcare as well, and trying to explore new accessible ways that the communication is smoother and we can provide that. So.
I think I agree with, again, both of those things, but I think also just recognizing bias. I think bias is inherent in everything that we do, but also recognizing our cultural biases and acknowledging them is really important because otherwise we can't get better. So just making sure that if we do have a new community member around or a new patient who's of a different culture, just recognizing what biases might be distracting us and what might not be letting us communicate more openly with patients, and then based on that, communicating more effectively.
Yeah, I still continue to struggle with how to talk to my colleagues who are not from diverse backgrounds and who are not from minorities. I had to actually hold one of my colleagues today who was making a very privileged comment to recognize what was coming out of his mouth, which is very uncomfortable. Those are really uncomfortable conversations to point out to people. So I'm just wondering, do folks here have questions for any of us? Yes?
I have a question for anyone, but I've heard you all speak a lot about interpretation and benefits and some frustrations of working with it. So I work on a research team, and I do interpret speech Spanish at home, but I work with a clinical team, and there are actually limitations based on my job of what I'm allowed to interpret for and what I'm not. It makes sense. It's also really frustrating how to scale and not always be able to provide it. But my question is, I've noticed working with a clinical team that there are times when interpretation is not provided the way that it should be, or not offered when it should be. And I get really frustrated by that, but I also understand that can be really intimidating if you don't have experience using them before, those types of services. And I'm wondering, instead of just getting really frustrated about what we can do on the provider end to support colleagues and clinicians that maybe aren't comfortable or not sure or not familiar with using these type of services. And I just want to get some ideas of what we can be doing to support each other so that people are more willing to or more ready or feel more prepared to use those services from the provider end.
So you're asking how to enlighten providers to the value of
Support.
communication. You know, and I just, the challenge that many of us face is time. And unfortunately, we could save so much time with optimal communication. And I mean, I don't have the answer. It's a great question. I don't have the answer, but the answer is to somehow provide it in a way that's timely, affordable, helpful. It's great. A personal touch is great. There aren't always interpreters available. So it's a great question. I wish I had the answer for that.
I don't know that I have the answer, but I have two thoughts. And one is kind of, just the bottom line of communication. So how to have that conversation with a provider about, is your goal to communicate with your patient so that you understand them and they understand you, or is it to tick the box that you said the words you needed to say to communicate? And that's a hard conversation to have. But it leads to better outcomes in the end, and the future patients that provider will interact with will have better experiences because of that. The other thing is I train, we have 4 AmeriCorps members every year, and so in addition to just staff changes coming through, I'm pretty frequently training new people on how to do 90% of your job through an interpreter. And for the first few days, it's really intimidating. But I think, and I don't know if time would allow these types of situations, but the I do, we do, you do method of training, I find really helps. And within the first month, they're flying on their own using an interpreter in, 12 languages a day to communicate with patients. And I think that seeing others do it and understanding power of communication really breaks that down quickly.
Well, what I can say would be that I trained in New York, so we had always that blue phone, which I hated. It was like 10 meters cord, which I have to plug into my arm to just pull that. But one thing that I can suggest would be that, especially with the different communities, if there is let me put a provider for that, and you can just see how they interact. I think that would be a good first step, a learning experience, that how they provide, how they communicate. You can see, a lot of things are not just what we say, but a lot of things is body talk, for example. So one of the things, 1 or 2 times, you can just observe providers which come from the same community, and then, of course, I think times makes perfect, because in the first few times you're going to forget things, but you become better and better with experience, I guess.
I guess what I've seen is that I think accessibility to machines is always an issue. So like you were saying with the blue phones, having to plug them in, I did that in med school. Now we have like an iPad and like dialing up with the iPad. It's a very cool concept. I think that when you can find the iPad and when you can get it to work and you can get it to call a provider, I think that's great. I think the tough thing, like you were saying, is really time, because all of these interpretation services are, we don't have them everywhere in the hospital, which I think is also an issue, and I think we're trying to get more. But I know that every time I've had to use it, it's always been, you have to like fumble it into the room, you have to find a place to be like connected, you have to make sure it's connected to Wi-Fi. I think, obviously that's asking for a lot, but making a more accessible device almost would be good, you know what I mean? Something that you wouldn't have to roll in, something that you wouldn't have to plug in. Because unfortunately, when you're in the hospital, things are so fast, and that doesn't mean that you should compromise patient care by any means, but I know that to me that's been a barrier, is how often can I find this iPad, and who's going to give me the iPad, and under what lock and key is this iPad, you know what I mean? And so I think accessibility devices, and I don't know if you can make them smaller, or how we can make them more accessible and possible. That's going to be my next step, is how can I make this more accessible to physicians in the hospital? Because as a resident, I know that my job is to get an admission done within 30 minutes. Do you know what I mean? And that's not the correct way to think about it, but that's a common mentality, unfortunately. If we can find a way to make it more accessible and more utilizable and not so cumbersome, I think that would definitely help out a lot.
No, I was just thinking about, because I do have experience using the language line or the phone, and one thing that I find that is helpful is the same way that when I talk to a patient who may not be health literate, I change the way how I talk and describe to ensure that they understand. And I find that when you ask a translator to do that, it actually makes it easier for them to translate the information, because you're not using medical jargon, and in some languages that jargon doesn't exist, so then they don't know how to communicate a specific medical term. But I think that we as providers can do that as we're talking to our patients, to use language that might be easier to be translated. But at the same time, if your translator understands what you're saying, it makes it easier for them to translate to it.
Which is hard when you can't see the translator.
Yeah.
It's so challenging.
It is.
Yeah.
I have a question about at-risk children. So at Children's, when you identify refugees or immigrants that have high-risk children and committed children, and then they're released, do you have a case manager or anybody that follows these high-risk groups, or is there any type of identification of these children in the educational system that they alert, like the healthcare system, that these are vulnerable people?
Not that I'm aware of. I'm not aware of anything like that.
There's no case management for people that are new to this country.
Not that I know of.
Uh,
That's a great question.
yes.
This is a slightly rhetorical question because it's something I've been asking myself and others for 15 years and haven't gotten a good answer, but if you've got one, I'd love it. As the program director for a program that touches about 50% of the agencies that are here in this room, including everybody there, and then lady for Forbes, you probably have no idea what our program is. You mentioned that Allegheny County has a large population of immigrant, refugee, cultural differences, which is great, and a large number of programs, which is great. How do we make sure that they know that? I was fortunate enough to sit beside someone who is one of our partners who had no idea what our program does. And that, as having been in this role for 22 years, it gets frustrating at a point where you say, but we have this, but we have this. So, Facebook isn't doing it, the web isn't doing it. I'm always struggling for a way that we can, in a county this large, with as many resources as we have, figure out, and I don't just mean the program that I represent, but other programs that are sure in the room, how do we get, other than an individual, Kathleen knows who I am, but how do we get to people to say, look, your agency participates in this program, or it's here, and you can access it. Like I said, it's a rhetorical question, but if anybody has any ideas of how we can improve that, I'd love to hear it, because I'm getting ready to retire. I'd really like more people out here.
So what's your agency?
I work with the Adagio Health. I'm the regional director of the cancer screening program, the CDC funded cancer screening program. Free cancer screening, diagnosis, and treatment for uninsured people. It's the best kept secret in Allegheny County.
Yeah, sure is. Wow, what a great question.
Yeah.
Could we start here? Is there a way that you guys can disseminate who's who at this meeting as a part of an organization, just so that we amongst our group know what's here, just who's here?
Yeah.
We can share,
If
since we have
people
a
are-
sign-in sheet, we can share the resources we had with the groups that joined this workshop, and we can share with the participants at these stages.
Yeah.
My name is Simone, so I'm from Jamaica. So I'm just answering to her question. Sorry if I style you as her. So when I came here to Pittsburgh, I was a novice to what they have for immigrants, and UPMC has a program that it's to their employees, but so if you're an employee at UPMC and you're an immigrant, not necessarily an immigrant, but someone who needs help in every aspect of your life, they have a program called Life Solution. Thank you. So Life Solution is a program that helps you if you're an immigrant who can't speak English, who needs somewhere to live, you have marital problems, you need a lawyer, whatever aspect, food, clothes, the entire necessity. And Life Solution gears you where to go, helps you, not just helps you, but treats you like a baby coming up. You understand? So because of that, I'm able to say, look, Birmingham has a free clinic if you don't have a health insurance. Let me show you where Birmingham is. It's for people who have no health insurance, who cannot afford it, who does not want to be discriminated against. Oh, you have nowhere to live. There is Urban League downtown that will help someone who cannot afford it and needs help with their rent. So with this organization, I think you should have some form of website that says, this place is with Whitetulip, if that's how you pronounce it. These doctors or interns can help you. These are our number. This is a psychiatrist who can help you, and so on and so on.
Thank you. Does anyone know if AHN has this?
I work for AGH. Sorry.
Yeah. Do we have?
So I work for both places, I'm sorry, but I've not seen it at AGH. I've asked about it to help someone else who is from another country, and they don't have it yet. But with a program like this, that's how you establish it. You understand? Life Solution is not just for UPMC workers either, because you can put, I resigned from UPMC and I still use Life Solution. If I have a problem, if I'm sick, no insurance, no way out, my husband is abusive or whatever, Life Solution is that phone call away, and they don't just call you today, they call you for an entire week. Did you get this? Did this work for you? And so on.
Yeah.
So I work for Allegheny Health Network here. I work for the Center for Children Health. So I don't know if HN has that kind of organization, but within the Center for Children Health, what we're trying to do is provide information to the providers within the network on how to work with the refugee and immigrant, and provide them the tools that are available. Just like what Divya was saying, sometimes people may not even know where to find the help, even if it may be right there, So just making sure people have the resources. But to answer one of the questions that I heard over and over again is the resources that are available. At least for the refugee and immigrant, and Murad, I can send you that link. Sure. There is a link from the Department of Human Services, Allegheny County, with all the resources that are available in Allegheny County for refugees. Unfortunately, there's not much on health, but anything as far as housing, transportation, all the agencies that work with refugees and immigrants, the information about Scoring Health Center. We can send you that information through Murad, through Whitetulip. Yeah.
And then we can distribute that.
So if your email is not on the signing and you want to do these resources, please make sure your email is on the signing. When we follow up, we can
care plan, they come with this certain problems, and we already have a plan. If this patient comes with this plan, it's particular to that patient, and then contacted this provider, contacted this person, and then this is what you even, like, they even had the instructions to what kind of pain medication they get, what kind of, whatever, like, you name it. So I don't know, one idea is, I don't know, if ER gets an admission with any facilities here that can trigger some sort of a system-based notification, because whenever I put an order, it asks me automatically if there's a, let's say, sickle cell patient comes in, it asks me, oh, did you order the sickle cell patient, like, specific orders, meaning sickle cell patient has some needs and you can miss it because you're not, like, perfect, right? So there's a system to help us. So if, I don't know, from the ER, whenever they put in the admission orders or whatever you call it, the basic nurse, when they ask basically where are you from, what kind of language you use, and that automatically can generate some sort of a system-based order set. Maybe there is a, in the Allegheny Health Equipment, maybe there's a central inclusion hub, but then not all providers know automatically how to contact and everything. Maybe that can automatically generate a system-wide notification saying that, hey, there is a Somalian refugee admitted to this floor, so that all the resources can know, because that's like basically the easiest way to notify already like established system within the network.
We do that for like IV drug users and homeless patients right now. It's like an automatic referral to infusion hub, so when they come in, like if there's an overdose or someone who needs IV drug use, it gets automatically triggered. But I'm sure that there's a way to educate, usually like educate the ER residents, and then they automatically put it in the case management everywhere, but I think it's a good idea.
Is there any other questions?
So, since we're out of time, I just want to say thank you so much to Priscilla and Whitetulip Health Foundation. Your experiences is really not easy sharing those experiences. And I want to thank Dr. Zula, Kathy, and Dr. Abdu, and sorry. Thank you so much for coming and for presenting and talking to us about hormonal awareness in health systems. This is something that can go on forever. It's not just like 1 hour that you sit down and talk and know everything. So we really appreciate your time. If you